If you're watching this video, you or someone you love probably has hypothyroidism, but do you know how or why? In this video, I'll go over the types and causes of hypothyroidism, which is when the thyroid, which is a small butterfly-shaped gland found at the base of your neck, doesn't produce enough thyroid hormones. I'm all about the self-promotion here, so if you want the full version of how your thyroid works, you can check out this video. For now though, here's a simplified overview. The hypothalamus in your brain makes the hormone TRH, which is short for thyrotropin-releasing hormone. This then tells your pituitary gland, also in the brain, to make the hormone TSH, or thyroid-stimulating hormone. This then tells your thyroid to make the hormones T3 and T4. And these hormones then tell everything else in your body to speed up and work harder. As you can see, there are several stages to this process, each of which can go wrong and cause your body to slow down, resulting in 4 main types of hypothyroidism. First is primary hypothyroidism, which is where the thyroid is affected directly, and so it doesn't make enough thyroid hormones. This is by far the most common type, and is responsible for 99% of hypothyroidism cases. Secondary hypothyroidism is where your pituitary gland is infected, and so it doesn't make enough TSH, which in turn causes low thyroid hormones. This is normally due to non-cancerous tumour on the pituitary gland. Tertiary hypothyroidism affects your hypothalamus, and so it doesn't make enough TRH, which in turn leads to the pituitary gland not making enough TSH, which then leads to your thyroid not making enough thyroid hormones. You can also get subclinical hypothyroidism, where you have too much TSH but everything else is normal, and this normally goes away on its own within a few months. There are several factors that can increase the risk of developing hypothyroidism, such as being assigned female at birth, or AFAB, having a family history of thyroid disease, having another autoimmune disease, such as celiac disease or type 1 diabetes, and having had thyroid surgery or radiation to your neck or upper chest. As for the causes, Hashimoto's disease is the leading cause of hypothyroidism in the UK, and accounts for around 90% of adult cases. It's often used interchangeably with the term hypothyroidism, but is in fact the reason for an underactive thyroid, rather than the underactive thyroid itself. Hashimoto's disease is an autoimmune disease, which is where your body mistakenly attacks your thyroid, for reasons which are still shrouded in scientific mystery. As with any autoimmune disease, Hashimoto's tends to run in families, and disproportionately affects people AFAB, who are 10 times more likely to develop it than people assigned male at birth, or AMAB, again for reasons currently unknown. Hashimoto's disease is actually a type of thyroiditis, which by definition is an inflammation of the thyroid gland, and typically causes hyperthyroidism before turning into hypothyroidism. Unfortunately, Hashimoto's is a chronic condition, and so stays in the hypothyroid stage forever, as opposed to some other types of thyroiditis, which can go away over time. An example of this is postpartum thyroiditis, which is also an autoimmune disease, that is subclinical or invisible, but then aggravated after pregnancy. Once again, experts don't know what causes this condition, but basically what happens is that during the inflammation, the walls, or follicles, storing your thyroid hormones, are broken down, which releases loads of thyroid hormones into your bloodstream. This causes the phase of hyperthyroidism, where there are too many hormones, but once they have been used up, there are no longer enough, causing the hypothyroid stage, which can last from around a year to a lifetime. This affects around 5% of mothers, and just to confuse matters, sometimes only results in one or the other, hyper or hypothyroidism. Other types of thyroiditis include subacute thyroiditis, aka de Quervain's thyroiditis, which is usually painful and thought to be caused by a virus, usually after an upper respiratory tract infection, and this normally goes away with the disease, although sometimes needs to be treated with drugs such as steroids to reduce the inflammation. Similar to this is acute thyroiditis or infectious thyroiditis, which is rare and caused by any form of infection other than a virus, such as an invasion of the thyroid by bacteria, fungi, or flatworms, and is normally treated with antibiotics and managed with painkillers. Thyroiditis can also be drug-induced, and is very rarely caused by medicines used to treat other diseases. Examples of these are lithium, which is usually used to treat mental health issues like depression or bipolar disorder, amiodarone, which is used to treat an irregular heartbeat, and interferons, which are used to treat certain types of cancer and hepatitis C, and this is normally reversible by ceasing use of the drug. Thyroiditis can also be caused by radiation used to treat certain cancers and radioactive iodine used to treat hyperthyroidism. Another rare form of thyroiditis is Riedel's thyroiditis, which I still pronounce in my head as Riedel's, which is chronic and categorized by fibrosis of the thyroid gland, which is where the thyroid tissue thickens or scars and is treated with steroids or surgery. As for the good old-fashioned hypothyroidism, the main cause in countries where iodized salt isn't readily available is iodine deficiency, as iodine is extremely important in making thyroid hormones. This can cause goiter, which is an enlargement of the thyroid gland, as it grows bigger in an attempt to absorb more iodine from your bloodstream, and luckily this can be reversed by taking iodine supplements. Hypothyroidism can also be caused by surgery to remove some or all of your thyroid, which is done to remove thyroid cancer, cysts, or treat hyperthyroidism, and this is known as postoperative hypothyroidism. Another rare cause of hypothyroidism is congenital hypothyroidism, which all babies in the UK are screened for with a heel blood prick test after birth. This affects around 1 in every 3,500 babies born in the UK, and again is more common in babies AFAB than babies AMAB. This can happen when the thyroid doesn't move from the back of the tongue to its normal position in the neck during the early months of pregnancy, and sometimes the thyroid doesn't develop at all. Very rarely, the thyroid can develop in the right place but be unable to produce thyroid hormones, and this type of congenital hypothyroidism is hereditary. This, along with postoperative hypothyroidism and Hashimoto's postpartum and radiation-induced thyroiditis, is currently treated with thyroid hormone replacement tablets, most commonly in the form of levothyroxine, which is a synthetic form of thyroxine or T4. Clearly, there is still so much to be discovered about what causes these forms of hypothyroidism, so hopefully one day soon we can find a cure or prevention rather than simply treating the outcome. Thank you so much for watching, and I hope this helped.